Module 4, Chapter 29, Sexual Assault. Objectives. Define sexual assault, sexual violence, attempted rape, and completed rape. Identify perpetual relationships between sexual offenders and victims, including marital rape, statutory rape, date rape, and drug-facilitated sexual assault. India. A 20-year-old woman is brought to the ED by two friends who say that Indira has been hurt by someone at a party they attended, but she won't tell them who hurt her or what happened. She was willing to be brought to the ED, however. One friend says, "We were at this party when these guys introduced themselves, and one asked Indira to dance with him. We tried to keep our eyes on each other, but we lost track of Indira somehow until we found her in a bedroom upstairs. She was all messed up and crying." Sexual assault and sexual violence. Sexual assault and sexual violence are unwanted sexual advances and sexual harassment. Rape is attempted rape and completed rape. And other forms of sexual assault or sexual violence is incest, human sex trafficking, and female genitalia mutilation. Threats of rape or intention to rape that is unsuccessful is referred to as attempted rape, and a completed rape is defined as that it is rape with a completed actual task. Attempted rape. Threats of rape or intention to rape that is unsuccessful. Completed rape is any penetration, no matter how slight, of the vaginal or anus or any objects or body part, or oral penetration by sex organ of another person without the consent of the victim. Spousal or marital rape, statutory rape, minors do not have the capacity for consent. Date rape and acquaintance rape takes place, and drug-facilitated sexual assault. Now, the Drug-Induced Rape Prevention and Punishment Act of 1996 allows up to 20 years imprisonment and fines for anyone who intends to commit a violent crime by administering a controlled substance to an unknowing individual. Due in large part to the feminist movement, marital rape was outlawed in 50 states by the early 90s. It took longer for laws to sentence perpetrators the same way. One U.S. state still requires that violence or the threat of violence exist in order for it to be considered rape. Law and sexual assault. Known legal definitions in your state. No state reporting requirements. All states require reporting if the victim is defined as a child by state law. Most states require reporting if the victim is a dependent adult. State and tribal government must reimburse for sexual assault examinations. Objectives are discuss the epidemiology of rape, stalking, or sexual assault. Describe the role of the sexual assault nurse examiner to a colleague. Epidemiology. Rape victims, 19.3% of women and 1.7% of men. For females, the first rape experienced happened before age 25 years in nearly 79% of the victims, before age 18 in 40% of the victims. Both males and females are more likely to be raped by a male. The lifetime prevalence and 12-month prevalence of intimate partner rape is estimated at nearly 9% and around 1%, respectively. Epidemiology continued. Stalking is about 15% of women and nearly 6% of men. In 12 months, 4% women and 2% of men are stalkers. Sexual violence is unreported usually. There are nurses that specialize in sexual assault services. Sexual assault nurse examiners called SANE nurses. RNs with specialized training in caring for sexual assault patients, demonstrated competency in conducting medical and legal evaluations, and the ability to be an expert witness in court. These nurses know how to actually collect evidence and to know how you do the chain of command so that the evidence never leaves the site from one chain to the next. Sexual assault response team is a SART team. To understand the long-term effects of sexual assault, it can cause depression, suicide, anxiety, fear, difficulties with daily functioning, low self-esteem, sexual dysfunction, and somatic complaints. Additional effects, individuals may experience recurrent intrusive memories, dreams, flashbacks, and psychological and physiological distress in response to cues that remind the individual of the assault. Dissociative symptoms, altered sense of reality, inability to remember, amnesia, parts of the traumatic event. Avoidance of situations, places, events, or object that object that reminds them of the experience. Hyper alertness, easily startled, anxiety, anger outbursts from the additional dysregulation from the traumatic event, and some people experience depersonalization or derealization. Effects of history of sexual abuse in psychiatric patients. You'll see depression, anxiety disorders, chemical dependency, suicide attempts, self-mutilation, compulsive sexual behavior, and psychosis-like symptoms. The effects of incest. Incest victims may experience negative self-image, depression, eating disorders, personality disorders, self-destructive behaviors, and substance use. Application of the nursing process. Objectives. Describe common reactions to rape and sexual assault. Identify 5 areas to assess when working with a person who has been sexually assaulted, and analyze personal thoughts and feelings regarding rape and its impact on survivors. Assessment. A general assessment, the level of anxiety, coping mechanisms, available support systems, signs and symptoms of emotional trauma, and signs and symptoms of physical trauma. Self-assessment is examine your feelings before encountering a patient who has been sexually assaulted. Always avoid asking why questions because they inherently um, evaluative. For example, why did you walk home alone? Why didn't you run? Can also put the person or the victim in a defensive situation. Best practice guidelines. Examination always involves 5 steps. Head to toe physical assessment for signs of injury. Detailed genitalia examination. Evidence collection and preservation. Documentation of physical findings and treatment, discharge, and follow-up care. Indira, a student whose friends have brought her into the ED after a party, tells the nurse that she has been raped. She is shaking and begins to sob, hyperventilating. She appears to have a small amount of blood under 3 of her fingernails on each hand and bruises on her wrist and inner thighs. Her lip is beginning to swell and she has a scratch along her jaw and eyebrow. Predict what information should not be obtained during Indira's initial medical examination. Ascertaining what she might have done to provoke this situation. B. Documenting biological and physical findings. C. Collecting evidence. D. Arranging follow-up as needed to document additional evidence. The answer is A. It is appropriate to obtain all the following at this point, with one exception, asking what she might have done to provoke the sexual assault. There is never an appropriate question, and this is never an appropriate question and has been referred to as a victim shaming process. It is a major reason sexual assaults go unreported. Other types of information are appropriate: documentation of biological and physical findings, collection of evidence, and follow-up as needed to document additional evidence. What areas should you include in your initial assessment of Indira? Assess psychological trauma and document the patient's verbatim statements. Assess the level of anxiety. If in a severe to panic level anxiety, the patient or the client will not be able to problem solve or process information. Assess physical trauma. Use a pre-printed body map and ask permission to take photos. Assess available support system. Offer partners or family members. Often partners and family members do not understand the trauma of rape, and they may not be the best supporters to draw on at this time. 5, identify community supports like attorneys, support groups, therapists that work in the area of sexual assault, and encourage the client to talk about the experience, but do not press the patient or the client to do so. What would some appropriate questions be to ask Indira to determine her coping mechanisms? What are you thinking and feeling? What can I do to help you in this difficult situation? And what kind of things have you done in the past that help you? Objectives: identify priority nursing diagnoses to address responses to sexual assault. Formulate 2 long-term outcomes and 2 short-term goals for the nursing diagnosis rape trauma. Primary nursing diagnoses. Victim of sexual assault, rape trauma responses. The diagnosis of rape trauma response addresses longer term reactions. It is defined as a maladaptive response that occurs to a victim after rape associated with disorganized lifestyle and long-term process of reorganization of their lifestyle. Um, Potential additional nursing diagnoses can be disturbed personal identity, situational of low esteem, interrupted family process, impaired sexual functioning, anxiety and or fear, social isolation. Some of the outcomes you can see is improved responses to the traumatic experience. In the outcome identification planning, outcome identification improves responses to the traumatic experience. Plan to care must include follow-up care for post-acute phases. Improvement may be indicated prior to leaving acute care setting, including verbalizing details of the experience, expressing feelings, understanding the common responses to assault, identifying a short-term plan to deal with the immediate situation, and connecting with a community-based rape victims advocate. Longer-term goals include physical healing, emotional healing of intrusive memories and nightmares, reduction in fear and anxiety, and improve social interactions. Objectives. Identify 5 overall guidelines for nursing interventions related to sexual assault in emergency settings. Discuss 3 evaluation criteria that would indicate improvement of responses or resolution for a person who has suffered a sexual assault. And identify psychological therapies that are useful in treating individuals who have experienced sexual assault. In implementation counseling, it's especially important to help the survivor and significant others to separate issues of vulnerability from blame. Although the person may have made choices that made her more vulnerable, she is not to blame for the rape. She may, however, decide to avoid some of those choices in the future, like walking alone late at night, excessive use of alcohol, and focus on one's behavior, which is controllable and allows the survivor to believe that similar experiences can be avoided in the future. Promotion of self-care activities and case management. Recommended emergency nursing protocol. Provide safe and private environment. Assess to community-based advocate. Administer trauma-informed approach. Consistent, objective, immediate medical care. Care and consultation with a sane, trained forensic nurse. Medically appropriate STD prophylaxis and emergency contraceptive. Part of providing consistent, objective, immediate medical care includes the collection of evidence by emergency nurses and physicians who know the protocols for evidence collecting. Indira, a student who was raped at a party, accepted care in the ED and was referred to a nurse counselor after to help with recovery. Specific areas of concern for her were intrusive symptoms, including flashbacks, nightmares, and frequent interruption of sleep. At first, she received private counseling, but later she joined a group session, which she found supporting and encouraging. Evaluation. Sexual assault survivors are considered to be in recovery if they are relatively free of any signs or symptoms of acute stress disorder and PTSD. Signs of recovery include sleeping well with few instances of episodic nightmares or broken sleep, eating as they did before the rape, being calm and relaxed or only mildly suspicious, fearful, or restless, getting support from family and friends, generally positive self-regard about themselves, and the absence and or only mild instances of somatic reactions, returning to pre-rape sexual functioning and interest. The patient will sleep well with few nightmares or wake-ups, eat as they did pre-rape, retain normal levels of calm and relaxation, get support from family and friends, demonstrate positive self-regard, experience little or no somatic reactions, and return to pre-rape sexual functioning and interest. Treatment modalities, psychological therapies by advanced nurse practitioners in individual, group, survivors, and perpetrator groups. By virtue of the legal definition of the relationship, rape cannot occur within a marriage. A, true, or B, false? The answer is B, false. Rape is defined in the context of non-consensual activity and involves any penetration of the vaginal or anus with an object or body part, or the oral penetration by a sex organ of another person. In recent years, courts have recognized spousal or marital rape in which the perpetrator, nearly always the male, is married to the person raped. Endura's flashbacks, frightening thoughts, recurrent memories, and nightmares are associated with which category of symptom in PTSD? A, intrusive symptoms, D, dissociative symptoms, C, avoidance symptoms, or D, arousal symptoms? And the answer is A, intrusive symptoms include recurrent and intrusive memories, dreams, flashbacks, and psychological or physiological distress in response to cues that remind the individual of the assault.